So in this video we are going to cover today the obturator nerve, accessory obturator nerve, obturator artery and also the medial circumflex femoral artery. So let's start our discussion with obturator nerve. You can see here this nerve is obturator nerve. So actually this obturator nerve is a chief nerve of the medial compartment of the thigh. The origin is it's a branch of lumbar plexus mainly formed by ventral divisions of L2, L3 and L4. L2, L3, L4, their ventral divisions join together to form this obturator nerve. Right, in the upper part of the nerve it lies in the pelvis and it enters the thigh by passing through the obturator canal, which is present of course in the obturator foramen. So the course and relations that within the obturator canal the nerve in turn divides into the anterior division, which you can see in the front, and posterior division, which you can't see, which is back of this obturator externus muscle. So mainly this obturator externus muscle is dividing the obturator nerve into anterior division and posterior division. So the posterior division from the back, it has come back of adductor brevis muscle, and you can see this is the posterior division and this is the anterior division, right? So like this the two divisions are formed by means of obturator externus muscle, right? And later it descends behind the pectineus and adductor longus muscle. So it is passing behind the pectineus and also the adductor longus muscle. Okay, so and also in front of adductor brevis. So the anterior division mainly supplies the pectineus muscle. So if you see the anterior division of this muscle, this supplies mainly the pectineus muscle, right? It also supplies the adductor longus muscle, supplies the gracilis muscle and adductor brevis. In the previous video, as we discussed about the adductor muscles, there only I have said already, except the adductor magnus. Adductor magnus is supplied by our posterior division, and also adductor brevis maybe have both chance to supply either by anterior division, posterior division, but the remaining muscles like our pectineus, adductor longus, gracilis, of course adductor brevis, all these are supplied by anterior division. Okay, they are not supplied by posterior division. And the anterior division also gives a branch to the hip joint. So here's the hip joint, right? So that is an articular branch to the hip joint. So below the lower border of adductor longus, it supplies to a twig of subsartorial plexus. Actually in this side here will be a subsartorial plexus. So even this anterior division will also, you can see here, it is going and supplying even to the subsartorial plexus, and hence by supplying the femoral artery in adductor canal. It also supplies the femoral artery. If you remember, the femoral artery will be also here. So it will also supply the femoral artery and end in the adductor canal finally here. Here will be the adductor canal. So finally it will end there. So what you have observed that the anterior division is giving 4 muscular branches, one for pectineus, one for adductor longus, one for gracilis, one for adductor brevis. So 4 muscular branches, one articular branch to the hip joint. Okay, and it is giving one vascular branch to the femoral artery, and one plexus for subsartorial plexus, right? So these are all the different parts, and finally it will end in the adductor canal here, right? So now coming to the posterior division, the posterior division is coming like that. This one is the posterior division. So it enters the thigh by mainly by piercing the upper border of obturator externus. It descends behind the adductor brevis in front of adductor magnus. It also gives branches to mainly 3 muscles, that is obturator externus, adductor magnus, adductor brevis. I already said the adductor magnus is supplied by posterior division of obturator nerve, and also the obturator externus is supplied by posterior division of obturator nerve, and also the adductor brevis. Okay, if adductor brevis is not supplied by anterior division, then it will be supplied by this. And finally in the adductor canal, it is reduced to a thin genicular branch which enters the popliteal fossa, pierces the oblique popliteal ligament, okay, and ends by supplying the capsule of cruciate ligament. So it supplies a cruciate ligament at this knee joint here, okay, and ends by supplying the cruciate ligament and of the knee joint. Some of its fibers end by innervating the popliteal artery. So some of this posterior fibers of obturator will go and innervate on the posterior side of patella. You know, we have popliteal fossa, so there they will innervate the popliteal artery. So let us see what is the clinical anatomy which is related to this obturator nerve. Okay, so any spasm of adductors of thigh in certain intraceable cases of spastic paraplegia may be relieved by surgical division of obturator nerve. So if there is any paraplegia, any problem over this medial compartment adductor, if we cut over the obturator nerve, then there may be relief. Okay, relief of surgical decision of obturator nerve. Next, coming to disease, any disease of the hip joint may cause referred pain in the knee. So any disease in hip joint, but you are getting pain in knee. Why? Because there is a referred pain in the knee on the medial side of the thigh because of the common nerve supply by obturator nerve. As I said, up to the popliteal artery, means up to here, the nerve which is supplying it is obturator nerve. So any pain in the hip joint, then it will also reflect to the knee because of the obturator nerve. Okay. So now we will discuss about accessory obturator nerve. For that we need to see another diagram. So this diagram you can see here, you can find the accessory obturator nerve. It's very rare, only in 30% of people you will find it. Actually it is a branch of lumbar plexus and it is formed by ventral division of anterior primary nerve of L3 and L4. Normally obturator nerve is coming from L2, L3, L4 ventral divisions, but this accessory one is coming from only L3 and L4. L2 is not involved here. Only L3, L4 ventral divisions will form the accessory obturator nerve. It is descending along the medial border of psoas major. So along the medial border of psoas major it will descend. So here you can see in this diagram you can understand this is the psoas major muscle, right? So only from L3 and L4. Actually obturator nerve come from L2, L3, L4. But this accessory obturator nerve will come only from L3 and L4 and it will go along the medial border of psoas major, crosses the superior ramus of pubis behind the pectineus. So here will be pectineus major. So behind the pectineus it will go, okay, and terminates by dividing into 3 branches. It will also divide into 3 branches. One branch supplies the deep surface of pectineus, another supplies the hip joint, and one more one will supply third communicates with anterior division of obturator nerve. Okay, so sometimes the nerve is very small and end by supplying pectineus only. So in this diagram you can see this is accessory obturator nerve. You can see it is dividing in turn into 3 branches. One is supplying pectineus, one is going to the hip joint, okay, and one will be articulating with the communicating with the anterior division of obturator nerve. This is normal obturator nerve, this is the anterior division. So with the anterior division also it may communicate. Okay, sorry, this is the anterior division, this is posterior. So you can see this anterior division, it's communicating with the accessory obturator nerve. But only sometimes this nerve may be present, and sometimes it's very small that it only supplies pectineus. It will not have that other 2 branches. Okay. So our next topic is about obturator artery. You can see the acetabular branch of obturator artery. Okay, about this now we are going to discuss. It is a branch of internal iliac and it accompanies the obturator nerve in pelvis. So along with the obturator nerve only it is present. At the upper margin of obturator foramen, the obturator artery in turn divides into anterior and medial and posterior or lateral branches. So what they are saying, it will divide into anterior or medial, posterior or lateral. That is nothing but only 2 branches. Anterior, posterior, you can say like that, okay, which form a circle over the obturator membrane and anastomos with medial circumflex femoral artery. So we will have a medial circumflex femoral artery. With that, this obturator artery will anastomos. Okay, both branches mainly supply neighboring muscles. The posterior branch also gives acetabular branch. This acetabular branch is the posterior branch. Okay, and which passes through acetabular notch. It passes through acetabular notch. Okay, to supply the fat in acetabular fossa, sends a twig to head of femur along round ligament. So this also sends a twig to the head of femur along round ligament. Okay, so this is about obturator artery. So remember, only it has 2 branches, that is anterior also called as medial and posterior also called as lateral. They are actually forming a circle around the obturator membrane. If you remember, here is the obturator foramen, there forms obturator membrane. So around obturator membrane they form a circle and anastomos with the medial circumflex femoral artery. So what is the medial circumflex femoral artery? About that we are going to discuss here. So this is the medial circumflex femoral artery. Okay, this is the medial circumflex femoral artery, and this is its ascending and this is its transverse branch. So let us discuss about this. This artery actually arises from profunda femoris. Of course, the profunda femoris is the deep branch of the femoral artery, but frequently it may also arise directly from the femoral artery. So this leaves the femoral triangle by passing backward between the pectineus and psoas major muscle. So it will pass backward between the psoas major muscle and the pectineus muscle. You can say this is pectineus, psoas major. So between them, this is the circumflex femoral artery, right? So it continues backward between the obturator externus and adductor brevis. So you can say this is obturator externus, this is adductor brevis. So between them, so first it will pass between both P's. What are those both P's? Psoas major and pectineus. Next it will pass between obturator externus and adductor brevis, right? So after that it continues backward and ends in a gluteal region between the quadriceps femoris and adductor magnus. So between the quadratus femoris and adductor magnus, you can see. So between them it will come, okay. And after entering here, they divide into the ascending and transverse branch. So this is the ascending branch and this is the transverse branch. So before giving off the terminal branches, the artery gives off many muscular branches and also an acetabular branch which passes through acetabular notch. So it will also give an acetabular branch which will pass through the acetabular notch to supply the fat in the acetabular fossa. It also sends a twig to the head of the femur and along the round ligament. So it also gives a fiber to head of the femur along the round ligament. So this is all about the circumflex femoral artery. Just remember, first it is between two P's, that is psoas major, pectineus. Next between obturator externus, adductor brevis. Okay. Next between quadratus femoris and adductor magnus. So first comes brevis, next magnus. Okay, between quadratus femoris, adductor magnus. So once you can revise them, first it is between psoas major, pectineus. Next it is between obturator externus, adductor brevis. Next it is between quadratus femoris, next adductor magnus. Next it gives two branches, ascending branch, transverse branch. It supplies even the fat around the obturator acetabular branch, which supplies around the acetabular notch. If you remember what is acetabulum, in the hip bone on the lateral side you will have acetabular notch which articulates with the head of the femur to form hip joint, right? So that acetabular notch is also supplied by acetabular branch of this femoral artery, and also it supplies a twig of head of femur along round ligament. So it also supplies a head of femur along the round ligament. So this is about the circumflex femoral artery. So by this we have completed all the medial compartment of the thigh. So next we'll start with the gluteal region.